What is heart disease? The heart is a fist-sized organ that is useful for pumping blood throughout the body. This organ is the main part of the circulatory system in every person's body. The heart contains four main parts made of muscles and driven by electrical impulses. The brain and nervous system are elements that make the heart function normally. Understanding heart disease. Heart disease is a condition that affects the heart so that it does not function normally. This disease generally refers to conditions that involve narrowing or blockage of blood vessels that can lead to a heart attack, chest. This is because conditions that affect the heart can cause major problems and even death. Causes of heart disease. There are many causes of heart disease depending on the triggering factors. Accumulation of fat in the blood vessels of the heart is known as atherosclerosis, which is the main cause of coronary heart disease. If this happens, blood flow to the heart will be completely blocked and a heart attack can occur. There are several factors that cause heart disease, such as smoking habit, high cholesterol levels, lifestyle is not maintained, hypertension or high blood pressure increases, obesity, presence of diabetes, age and gender factors. Heart disease risk factors. There are several factors that can increase a person's risk of heart disease, namely age, gender, family history, smoking habit, poor diet, high blood pressure, high blood cholesterol levels, has diabetes, being obese, not physically active, experiencing stress, have poor dental health. Symptoms of heart disease. In some cases, heart disease may be difficult to detect and go undiagnosed until a person experiences symptoms associated with the disorder. Well, some of the symptoms that appear include heart attack, chest pain or discomfort, upper back or neck pain, indigestion, heartburn, nausea or vomiting, extreme tiredness, dizziness and shortness of breath, arrhythmia, a pounding feeling in the chest, palpitations, heart failure, shortness of breath, fatigue, to swelling in several parts of the body, such as feet, ankles, legs, stomach, or neck veins. Diagnosing heart disease that is not treated immediately will cause complications that can kill a person's life. When the heart does not receive sufficient blood supply to pump blood, its performance will decrease. Therefore, prompt diagnosis of the symptoms caused is important. For an initial diagnosis, doctors usually ask about symptoms, family medical history, and lifestyle. If the doctor suspects that you have heart disease, the doctor will suggest undergoing several tests, such as blood tests, electrocardiogram, coronary angiography, CT scan, and MRI scan. Heart disease treatment. Treatment for someone with heart disease is to manage symptoms and reduce the risk of bigger problems. The following is a more complete treatment action. Lifestyle change. Making changes to a healthier lifestyle can certainly reduce the risk of experiencing a more severe disorder. For example, quitting smoking after a heart attack quickly reduces the risk of having a future heart attack almost as much as a non-smoker. Other lifestyle changes include eating healthier and exercising regularly. Consumption of drugs. There are many types of drugs that are consumed to treat this heart problem. Usually useful for lowering blood pressure or widening blood vessels. Some heart drugs can cause side effects, so it takes a medical expert to determine the right drug. In addition, the consumption of this drug should not be stopped or changed without a doctor's approval. Here are some types of drugs that are commonly given. Blood thinners, statins, beta blocker, nitrates, angiotensin-converting enzyme, ACE inhibitors, angiotensin II receptor blockers, ARBs, calcium channel blockers, diuretics. Interventional or surgical procedures are usually performed when the disease can no longer be treated with medication. Well, some of the usual actions are coronary angioplasty, coronary artery bypass graft, liver transplant. Complications of heart disease. A person who has this disease and does not get treatment immediately can experience dangerous complications. Some of the complications, namely heart failure, heart attack, strokes, aneurysm, peripheral arterial disease, sudden cardiac arrest. Heart disease prevention. There are various ways to prevent heart disease that can be done, including implement a healthy lifestyle by reducing high cholesterol foods and exercising regularly. Quit smoking. Reduce alcohol consumption. Therefore, angina sufferers are recommended to take the drugs given by the doctor and according to the dosage. When to see the doctor. If the examination has been carried out and the results of the cardiovascular system health examination are declared good, the examination can be carried out once a year. However, if the results of the examination show abnormalities in the heart, routine examinations should be carried out more often. Thank you for watching video. Support me, subscribe and like.